Hi guys, hope you're all well. This is Ulas. Today we'll be studying the brachial plexus. Okay guys, let's get started. What do we mean by brachial plexus? Brachial is the arm. Brachial is related to the arm. So what do we mean by plexus? Plexus is a network. So guys, you know that right? Whenever we have to do a voluntary movement, the signal has to come from the brain, and due to different mechanisms, the signal is modulated in such a way that it enters the spinal cord with less disturbance, and from the spinal cord it enters the peripheral nervous system. The peripheral nervous system supplies the muscles, and this muscular contraction, the differential muscular contraction, causes different movements, isn't it? I'll be representing that now in this schematic diagram. See here guys, there is a signal which begins in the motor cortex of the cerebral hemisphere. Okay, then the signal is due to different mechanisms, it is modulated and then it enters the spinal cord. See guys, a brachial plexus is formed usually by the ventral rami of the spinal segment C5 to T1. Okay, guys, what do we mean by spinal segments? It's usually the parts of spinal cord between the different vertebra. So the first spinal segment is between the skull and the first vertebra, the first one. Second is between C1 and C2. The C1 is the cervical vertebra basically. C2 and C3 is the third segment. In the same way, if we go, there is C7, the last cervical vertebra, and this first thoracic vertebra. Between C7 and T1 there is C8. So there are 7 cervical vertebrae, but there are 8 cervical spinal segments. Okay, see here guys, between C5 to T1 there are nerve roots which are coming, and they are forming a network. Different ways they are forming network, and then they supply the different parts of the upper limb. This is known as the brachial plexus. We'll be studying that in detail now. Okay, see here guys, the brachial plexus is formed by the ventral rami of C5 to T1. In the first class we studied the ventral rami. Now what is ventral rami? Rami is a branch. From the spinal cord there are dorsal and ventral rami coming. Ventral rami are forming the brachial plexus. Okay, and I told you now guys, between C5 and T1 it is usually formed, but it can be by C4 or by T2. Okay, if the C4 is involved, T2 usually won't be involved. If T2 is involved, C4 usually won't be involved. So if C4 is involved, it's called as prefix type. If T2 is involved, it is called as postfix type. It's very rare that both can happen. Okay, we'll study that. Now. Formation of brachial plexus, guys. I told you now there are cervical spinal segments C5 to T1. Okay, guys, when you see the names of brachial plexus, it's usually formation is named under these headings: roots, trunks, the divisions, cords, and the branches. Guys, this is actually taking tree as a picture, the tree. So it begins with the roots, then with the trunk, and ends in the branches now. So the representation is similar to a tree. Okay guys, there are nerve roots C5, C6. The nerves ventral rami are coming. They both join and form the upper trunk of brachial plexus. Okay, they form the upper trunk of brachial plexus. We'll be studying what is that in detail. Then the C7, it always likes staying alone, so it will form the middle trunk of brachial plexus alone. Then there is C8 and T1. The C8 and T1 the ventral rami will join and form the lower trunk of brachial plexus, lower trunk. Okay, now they have formed the trunks. Then they divide into what? Anterior and posterior divisions. Anterior and posterior divisions. Anterior and posterior division. Okay, the roots form the trunk, and the trunks are dividing into anterior and posterior division. Anterior because it's in the front, posterior because it's in the back. Okay, then this is something interesting which happens. See here, all the posterior divisions are there now. They will form the posterior cord of brachial plexus. They will form the posterior cord. Then there is anterior division of the lower trunk, which will form the medial cord of brachial plexus. Okay, anterior division of the lower trunk will form the medial cord of brachial plexus. Then there is anterior divisions of the upper and middle trunk. I'll use a different color. Anterior divisions of the upper and middle trunk, which will form the lateral cord of brachial plexus. Okay guys, the formation is clear now. So what happens? They are basically nerve roots. Nerve roots, they come and join to form the trunks, nerve trunks, the upper trunk, middle trunk and lower trunk. Then they divide into two, anterior and posterior divisions. The posterior divisions of all form the posterior cord. The anterior division of the lower trunk will form the medial cord, and the remaining are upper two trunks now, the upper and middle trunk, they both will form the lateral cord of brachial plexus. Okay guys, now let's get to the branches. Guys, when we are reading branches in the textbook, there is something called as the root value. Okay, root value, when I was studying in first year, it was basically just numbers for me. After a long time, I realized a way to remember it. We'll be studying that. It will be helpful when we are studying the branches. Okay, see here. Guys, this was the C5 and C6 roots now. So, if it forms a trunk, what will be the root value of that trunk? Obviously C5 and C6, because there is no additional contribution. See here, C5, C6. Now what will be the root value of middle trunk? C7. And what will be the root value of lower trunk? It will be C8 and T1, isn't it? Sorry, C8 and T1. Now if the root value is like this, see the posterior cord. Posterior cord has contributions from all the three trunks. So the most branches or the branches of the posterior cord will have the root value from C5 to T1. But the contribution can be different. We'll be studying that when we are studying the branches. Then see the medial cord. What will be the root value? Most cases it will be C8 and T1. Then there is lateral cord. Lateral cord is having the contributions from C5, C6, C7, but it can be differential to different muscles. We'll be studying that. Okay. See here guys, the branches of the brachial plexus. The branches of the brachial plexus are divided basically mainly from the roots, from the trunks, from the cords. Okay. See here. Divisions don't give branches. Divisions don't give branches usually. See, from the roots there are two nerves mainly. There is one more for longissimus muscle. That's in the 41st gradation. It's not mentioned so well. So these two are the main nerves. See guys, from the root there is dorsal scapular nerve. So guys, this is a very interesting concept about the scapular nerves. There are three nerves basically: suprascapular, subscapular and the dorsal scapular. Why is it called so? See, this is a representation of the posterior aspect of the chest of a person. Now see here, there is one nerve coming like this above the scapula. This is known as the suprascapular nerve. There is one more going below the scapula. This is known as the subscapular nerve. Then there is one more going medial to the scapula. This is known as dorsal scapular nerve. See here, what I am drawing is the cervical spines. Okay, means not the cervical spines exactly, the representation of the spinal cord. Abhi dekhna what happens. See, there is suprascapular above, supra here. Then there is subscapular below, and there is dorsal here. So why is it called so? Supra is above na, but it is going posterior. Why not the posterior or anterior scapular? Now, why didn't they call that? Because this is not the naming based on the erect position. It is based on the four-legged animal position. See, for me scapula is like this, but for four-legged animal it is like this. So a nerve which is going above it will be the suprascapular, below it will be the subscapular, and dorsal scapular, because it is in the dorsal aspect, it will go medially. So very easy to remember the muscle attachments. Okay, see here guys, there is one muscle or group of muscles here. What are they? They are the rhomboids muscles. Rhomboids, major will be below, minor will be above. Above that there is one small muscle called levator scapulae. We'll be studying that when we study in the neck. Okay, so those muscles will form those muscles will get contribution from the dorsal scapular nerve. Then there is suprascapular nerve. Suprascapular nerve ka matlab kya? It is supplying the muscles which are on the posterior aspect of the scapula. Which are those muscles? There are two muscles basically. There is a supraspinatus and infraspinatus. Okay, there is spine. Above the spine is supraspinatus, below the spine is infraspinatus. So if the suprascapular muscle is supplying them, so what is below the scapula? Below the scapula means the anterior aspect of the scapula. There is subscapularis. Subscapularis is supplied by subscapular nerve. Is it? So those were the nerves supplying different muscles on the scapula. Among them, the dorsal scapular nerve. The dorsal scapular nerve, it forms supplies the medial aspect. So medial aspect में कौन सा है? Levator scapulae, rhomboids minor, rhomboids major. Those three muscles are supplied by the dorsal scapular nerve. It's from the C5 root basically. So the root value of dorsal scapular nerve is C5. Then there is long thoracic nerve. Long thoracic nerve, where did we study? We studied that in the very beautiful muscle serratus anterior. Okay, what is the action of serratus anterior? It keeps the basically the protraction of scapula, and it keeps the medial border of the scapula holds close to the chest. It's also called nerve of Bell. So if that is damaged, there will be winging of scapula. Winging at rest? Not at all. It will be winging at action. When we ask the person to push the wall, if he comes to the clinic and you ask him to push the wall, then there is winging of scapula. But there is one more case where there is winging of scapula at rest. The medial border becomes prominent at rest. That is at the paralysis of trapezius muscle. Remember this, guys. In clinically, winging of scapula at rest is not by the serratus anterior. It is by the trapezius muscle paralysis. The serratus anterior muscle paralysis manifests as the winging only when there is action. Okay. Then branches from the trunks of brachial plexus. Guys, this is a very easy concept because the trunk of the brachial plexus, among them only the upper trunk gives the branches. Okay guys, the upper trunk of brachial plexus gives the branches, two branches. That is the suprascapular nerve and the nerve to subclavius. We studied that now. Subclavius muscle, where was it? It was between the first rib and the clavicle. So that is supplied by a branch from the upper trunk of brachial plexus called nerve to subclavius. Then there is suprascapular nerve. Where did we study it? We studied this 2.5 minutes ago. Okay, we studied that when there are two muscles on the posterior aspect of the scapula. So there is a supraspinatus which is above the spine, and there is infraspinatus which is below the spine of scapula. They both are supplied by the suprascapular nerve, which is a branch of upper trunk of brachial plexus. Okay. Next, what is the root value? If it's from the upper trunk, it will be usually C5 and C6 unless there is odd involvement of any other root. Okay, guys, see here. Okay guys, now we'll be studying the branches from the cords of brachial plexus. What do we mean by cords? Cords was, guys, we saw that there were roots, then there was trunk, and the trunk divided into anterior and posterior divisions, and different divisions joined to form the cords of brachial plexus. Okay, we'll be studying that in detail when we enter the arm. Here, the branches from the lateral cord of brachial plexus. What was lateral cord formed by? Lateral cord was formed by the anterior division of the upper and middle trunk of brachial plexus, isn't it? Abhi bolna. See, there is LML, which is the acronym for the branches of lateral cord of brachial plexus. most textbook give it, guys. It's quite effective in remembering. Yeah. Now, what is L? L is the lateral pectoral nerve. Where did we learn that? We learned it in the blood nerve supply of the pectoralis major muscle, and also according to some references, it also supplies the pectoralis minor muscle. Okay, then there is the musculocutaneous nerve. Musculocutaneous nerve. Why musculo? Because it supplies the muscle. Why cutaneous? It also supplies the skin. Okay. Then there is lateral root of median nerve. Median nerve is one of the very important nerves of the upper limb, and it has two roots, the medial and lateral root. They both join to form the median nerve. So the lateral root of median nerve is coming from the lateral cord. So then there is medial cord. If the lateral pectoral nerve is coming from the lateral cord, what will be the median cord giving? Medial cord will be giving the medial pectoral nerve. The counterpart of lateral pectoral nerve, medial pectoral nerve. Okay. Then if the lateral root of median nerve is given by the lateral cord, what will be the medial cord giving? Medial cord will be giving the medial root of median nerve. Okay. Medial root of median nerve. Guys, there are two interesting nerves here. That is the medial cutaneous nerve of arm and the medial cutaneous nerve of forearm. Why is it medial? Why is it cutaneous? Cutaneous because it's supplying the skin. Why medial? Because it is supplying the medial aspect of arm and medial aspect of forearm. So medial cutaneous nerve of arm and medial cutaneous nerve of forearm. Which one do you think would be bigger in size? Nerves are basically like the wires. So if the wire has to travel a long distance, it has to have a largest cross-sectional area. If it has to travel a short distance, it has to travel have a smaller cross-sectional area. So it is coming from here. Which is short distance? The arm or the forearm? Obviously the arm. So the medial cutaneous nerve of arm will be smaller. The medial cutaneous nerve of forearm will be larger. According to some references, that they say that the medial cutaneous nerve of the forearm is the largest branch of the brachial plexus. Okay. Then there is a very beautiful nerve here. That is called the ulnar nerve. It is also called the musician's nerve because it is very useful in the. It is responsible for the fine movements of the hand. We'll be studying that in detail Okay, guys. Now we'll be studying the branches of the posterior cord of brachial plexus. Guys, try to remember this acronym ULTRA. There's a reason for it. Most textbook mention it as lunar or ulnar. That will be helpful in remembering the branches. This will also be helpful in remembering the root values of the nerves. See here, guys. What is U? It is upper subscapular nerve. Where did we study the subscapular nerve? We studied this 5.5 minutes ago. Okay. The upper subscapular nerve supplies one muscle which is in the anterior aspect of the scapula. That is the subscapularis. Then there is lower subscapular nerve. That also supplies the muscle subscapularis, and one more muscle, the teres major. Okay, and then there is T. T is the thoracodorsal nerve. Thoracodorsal nerve. Try to remember it, guys. It's also called the nerve to latissimus dorsi. Okay, thoracodorsal nerve. It supplies the latissimus dorsi, the beautiful muscle. That is the sheet. Dorsi is behind, the sheet-like muscle from behind. It is inserted into the bicipital groove. Then there is R, which is the radial nerve, very important nerve of the arm. And then there is A, which is the axillary nerve, a very interesting nerve which has a very interesting clinical correlation. Basically, during intramuscular injections, the axillary nerve is injured. We'll be studying that in detail too. Okay. Now, how can we remember the root values of the different cords of brachial plexus? See here, guys, we studied that now the lateral cord of the brachial plexus was formed by anterior divisions of upper and middle trunk. So what will be the root value? That will be C5, C6, C7. Okay, so what will be the root value of the nerves from the lateral cord? Usually it will be C5, C6, C7 for all the nerves. Okay, but there is one interesting thing about musculocutaneous nerve. We'll be studying that. Okay guys, then there is the medial cord of brachial plexus. The medial cord of brachial plexus, how is it formed? Medial cord is formed by the anterior division of the lower trunk of brachial plexus, isn't it? So what is the root value of lower trunk? Lower trunk ka root value is C8 and T1. So this will also have the same root value, C8 and T1. See here, the all 4M, we remember this acronym as M4U, no? So all 4Ms will have C8 and T1. But there is one interesting nerve, the ulnar nerve. Ulnar nerve has the root value C7, C8 and T1. Where did this C7 come from? Did it come from the medial cord? Not at all. It came from the lateral cord, from the lateral root of median nerve. The lateral root of median nerve gives away some fibers to the ulnar nerve. Okay, so ulnar nerve also has the root value C7. So see, there is lateral root of median nerve which has the root value C5, C6, C7. It is giving C7 fibers to the ulnar nerve. The lateral root of median nerve is given to the ulnar nerve. So ulnar nerve also has the root value C7. Then there is posterior cord of brachial plexus. So posterior cord of brachial plexus, what is the root value? Sabhi root says, so it will be from C5 to T1, isn't it? C5 to T1. Sorry, it was 5. C5 to T1. Okay, so sabhi hai, but all nerves will have the same root value? No, there is difference. How? The reason we wrote it as ultra is the root value of the first and the last are C5, C6. Okay, C5, C6. Then the lower subscapular nerve also has the root value C5, C6. Okay, the first and the last and the second have the root value C5, C6. Then there is thoracodorsal nerve which has the root value C6. The next one, the C6, C7, C8. See here, the C6, C7, C8. They are the root values of upper and lower C5, C6. The third one, C6, C7, C8. Then there is an interesting nerve called radial nerve. Radial nerve has the root value C5, C6, C7, C8, T1. You know guys, in mythology they used to say ना, जैसे बाप जैसा बेटा, अगर इस बाप के तो 5 बेटे हैं पर एक बेटा बिल्कुल अपने बाप जैसा है. So that beta is the radial nerve. So radial nerve has the root value C5, C6, C7, C8 and T1. Okay. Guys, these were the branches of the cords of the brachial plexus. That ends here. Now there is a very interesting topic now. That is, what if the different parts of brachial plexus are injured? So what happens during an injury? We'll be studying that mainly as two injuries. The upper trunk injury, which is also called Erb's palsy. Then there is the lower trunk injury, which we'll call as the clump case palsy. Let's get started, guys.